Hi, everyone. Thank you so much for joining me. My name is Dawn Emerick, and I'm the Director of Metro Health. This video is so important to me and to all of my colleagues at Metro Health. Sometimes in our world of public health, we use a lot of jargon and a lot of really big, fancy scientific words like epidemiology and surveillance. And sometimes we forget that these are words that we are familiar with and that we're comfortable with. But it's also our responsibility to make sure that we translate this information to make sure that everyone understands what's going on. So this was a really important video for us to be able to do that. We also know that data is sometimes very hard to understand. Sometimes the data visualization is a little overwhelming for the general public. And we wanted to provide this opportunity to help translate the information so that you, the public, understands the information that we see every single day. So I'm really happy that you're here. We do have a responsibility to make sure that you are informed, that the data is transparent, and I really hope that this video helps with that. In this conversation, I will explain the data Metro Health has made publicly available on the City of San Antonio's COVID-19 website. I will also share with you how to download and access this data on the COVID-19 Open Data Hub site. You can find the COVID-19 dashboards by visiting covid19.sanantonio.gov. Today we will be talking about our two most popular dashboards, the Surveillance Dashboard and the Progress and Warning Indicator Dashboard. The Surveillance Dashboard shows important general information about the impact COVID-19 has had on our community. The Progress and Warning Indicator Dashboard shows data that is important to track as San Antonio reopens. These dashboards are updated daily at 7 o'clock p.m. Let's start with the Surveillance Dashboard. To navigate to this dashboard, visit covid19.sanantonio.gov. and then click on the Surveillance Dashboard icon. Once the dashboard loads, click Full Screen below the dashboard to expand it. You can also expand each section of the dashboard by clicking the circle that appears in the top right of each section. Let's start on the top left of the dashboard. The first number we see is total cases. This is the total number of people who have ever been infected with COVID-19 in Bexar County up until this point in time. This number is broken down into new cases, active cases, recovered cases, and deceased. Active cases are those that are known to still be ill with the virus at this time, and recovered cases are those who were previously ill with COVID-19 but have now recovered. You will see that the number of new cases for each day is also reported on the left, and this corresponds with the daily new cases that the mayor reports on. So putting it all together by looking at the current numbers, we see that as of today, we have 3,311 total cases so far. 1,156 of these are still ill. 2,077 have recovered, and 78 have died. Additionally, from the total cases, 21 are new cases discovered and reported in the past day. Next to that number, we see the words ever hospitalized. This number shows the total number of individuals who were hospitalized due to COVID-19 in Bexar County at some point in time. Below that number, we see ICU. This refers to the total number of individuals who have ever been in intensive care unit due to COVID-19 related symptoms in Bexar County. Next, we see ventilator. This is the total number of individuals who have ever been on a ventilator due to COVID-19 related symptoms in Bexar County. All of these numbers in the two top panels that I've described so far are really important for us to track and to document because they help us understand what the cumulative impact of COVID-19 has been so far on our community and our hospital system. Let's move to the graphs that appear below these numbers. The first graph that appears on the left is titled Reported Cases and Deaths by Date. Red bars show the total number of new reported cases each day. The white line shows the total number of new deaths reported each day. Cases are shown since March 19th. At the bottom of the column is a graph showing cumulative cases by date. This shows all the reported cases, deaths, recovered, and still ill cases by date. Still ill cases are those where individuals have not yet recovered. Cases are shown dating back to March 19th. These two graphs on the left-hand side help us see our COVID-19 numbers as a time lapse. For the most bottom graph, what we really want to work toward is for that red line to start plateauing and not shooting up diagonally in a straight line. Next, we see cases by age group. This bar chart shows the total number of cases in each age group ranging from ages 0 to 109. What we see here is that anyone in any age group can be infected by the virus, and that the majority of our cases so far are in the 20 to 29, 30 to 39, 40 to 49, and 50 to 59 year age groups. Below cases by age group, we see deaths by age group. This shows the total number of deaths that have occurred in each age group ranging from ages 0 to 109. We see in this graph that the older population, for example, those 60 and above, make up the majority of the deaths due to COVID-19. Be sure to note an interactive feature of this dashboard. Below the age group graphs, there is a tab that allows you to see additional case data. Click on the Race Ethnicity tab to see cases and deaths broken down by race and ethnicity. Additionally, you can view cases by gender and deaths by gender on the bottom right of the dashboard. Again, click on the tab called Source of Exposure below these charts to view additional data. Source exposure shows the percentage of total cases by the source exposure, such as community transmission, close contact, or travel. We see that so far, the majority of infections have occurred due to one individual coming in close contact with another individual who is then discovered to be infected. This is why this virus is tricky and why social distancing is so important. You may come into contact with someone who is infected, but neither of you know at that time that you're infected because the person is not yet fully visibly ill or showing symptoms. It is only discovered a bit later that this person was in fact infected back when you had close contact with them. Finally, let's briefly walk through the two maps available on this dashboard. The first map shows the range of cases by zip code. Case ranges are the following: no cases, 1 to 5 cases, 6 to 10 cases, 11 to 20 cases, 21 to 40 cases, 41 to 80 cases, and 81 or more cases. The darker zip codes fall into a higher range category of cases. You can click on the zip code to see more information about that particular zip code, including the total number of cases per 100,000 people. This is called the case rate. On the top right of the window, click on the search icon to search for a specific zip code, maybe where you live, maybe where your parents live, maybe where your children live. Click on the list icon to show the map's legend. On the bottom right of this window, click the arrow to show the same map in a different form. On this map, zip codes are also shaded by range categories of cases. The red bubbles shown represent the rate of cases for each zip code. The larger the bubble, the higher the rate of cases for that zip code. Now let's move on to the progress and warning indicators dashboard. These indicators are also outlined on page 13 of the COVID-19 Health Transition Team Report. You can find that report by entering Transition Teams into the search box at covid19.sanantonio.gov and clicking on the first link that appears. Progress indicators show the goals we must reach in order to flatten the curve. Warning indicators show the capacity of our healthcare system and whether or not COVID-19's presence is increasing in our community. Each indicator is labeled as P for progress or W for warning and has a corresponding number. Let's start with progress indicator number 1, or P1. P1 shows the total number of cases by reported illness onset date over a 14-day period. Cases are counted according to the onset date they report, meaning the date they first began experiencing symptoms. We need to show a sustained decline in the number of new cases for at least 14 days. Now let's take a look at progress indicator number 2. P2 is the current testing capacity countywide for all known testing facilities. This number is compared to the testing capacity goal of 3,000 tests per day. Testing capacity refers to the number of tests that can be conducted in one day. This gauge shows our progress towards a goal of 3,000 tests per day by comparing it to the current testing capacity. The number in the middle shows us how many tests we have the capacity to test in one day. We must keep an eye on P2 because we need to make sure our community has the ability to perform tests in all people with symptoms of COVID-19 and their close contacts. On to progress indicator number 3, or P3. P3 is important to keep track of because we must ensure we have enough personnel to identify all the close contacts of people diagnosed with COVID-19 who may be at risk and offer testing to them. We have a maximum goal of 175 contact tracers. 2 gauges are shown for P3. The first gauge shows the current number of contact tracing volunteers and personnel currently needed. The second gauge shows the current number of contact tracing volunteers and personnel who are trained and available compared to the goal of 175 contact tracers. In the first gauge, if the current number of available contact tracers exceed the current need, then the gauge maxes out at 100%. In the second gauge, the current number of available contact tracers is compared to the maximum goal of 175. Take a look at the next indicator, progress indicator number 4. This is a very important indicator because we need to ensure that our healthcare system is prepared to safely care for all patients. 3 indicators are shown here based on currently available data. Here we see number 1, daily count of positive patients hospitalized over a 14-day period. Number 2, daily count of positive patients in intensive care units over a 14-day period. And number 3, daily count of positive patients on ventilators over a 14-day period. This data is based on information provided daily to Metro Health by the Southwest Texas Regional Advisory Council, also known as STRAC. Are you still with me? I know this is a lot of data. Hang in there with me. Now let's start taking a look at the warning indicators. Remember, warning indicators show us the capacity of our healthcare system and whether or not the COVID-19's presence is increasing in our community. Warning indicator number 1, or W1. This shows the current number of days required for the number of cases to double. This is called the doubling time. We want this number to keep going up because that would indicate that the spread of the disease is slowing and that it's taking longer and longer for the number of cases to double as we go through time. Back when the outbreak began, we were doubling our cases every 3 to 5 days, but now it's taken approximately 29 days before we double our number of infections. So we're really moving in the right direction. Next is the warning indicator number 2, W2. W2 shows the weekly percentage of total tests that are positive for COVID-19 over a 5-week period. It is calculated as the percentage of positive tests divided by the total number of tests reported in 1 week. So let me repeat that real quick. I know it gets a little confusing when we start talking about formulas and percentages. So this particular indicator, again, is calculated as the percentage of positive tests divided by the total number of tests reported in 1 week. A warning is triggered when we see a rise in weekly percentage of the total tests that are positive. Finally, warning indicator number 3, or W3. This is an image of the health system stress score provided by STRAC. The stress score is a measure of the overall stress on the healthcare system. The stress score is calculated by STRAC and is reported on a regular basis to Metro Health. This stress score takes into account factors such as availability of personal protective equipment, also known as PPE, hospital beds, ventilator capacity, and increases in emergency system calls. So if you're anything like me and you really love data, then I think that you probably want to go a little deeper. So come with me. Just visit our COVID-19 Open Data Hub site. From here, you can download some of the data behind our dashboards and directly plug data sets into your applications. How about that? So if this wasn't enough for you, now we're giving you the data and you can play around with the data yourself. Go to COVID-19's homepage and click on View More Statistics and Reports. From there, scroll down, click on Download the data to access the site. Thank you so much for joining me and reviewing this important resource for our community. Please continue to check the COVID-19 website for new information as we continue to update these dashboards on a daily basis.